Now we will go into the forms to enter the hospitalization information for the patient. So we go into Manage Patient again. We select our patient, Asil Lisa, right here from the list. Confirmation. So we go next. And here, as you can see, the admission menu disappeared altogether because both options in that menu were completed. So it's no longer available. So here we will go ahead with the hospitalization. We enter into that option, and here this is one of the important new features in this version of the app. And this is what allows us to enter retreatment cycles for a patient. And this is one of the features that we discussed previously that was missing in the app, and with the previous version it was not possible to enter treatments that were longer than 10 days. Now we have the option to enter treatments of arbitrary length, and the key aspect of how the app works is that the treatment is entered in cycles of 10 days. And here we have one cycle that started. So if you look at this list, there are two columns: treatment cycle start date and cycle date. And what we see is that there is one entry, is the corresponding to the treatment cycle that started on January 22nd, 2011. Now it says that it's completed because the current day we are using the app is today, June 28th, 2018. So this cycle already ended, right? Because we are far past the 10 days after the date of starting this cycle. That's fine. We simply we can enter into that cycle even though it is completed, and then put all the relevant information. Then there is this big button right underneath that says Start New 10-Day Treatment Cycle, and that should be used only if the patient has been retreated and you have to enter additional treatment information. And we will do that for this patient. But first we will enter the data we have for the first treatment cycle. Again, it's okay that it says completed. We can select that treatment cycle, and then it will take us to this confirmation page where we see that this is we are going to enter data for the treatment cycle that started on January 22nd of 2011. It is correct, so we confirm, and we now have these two different forms. The clinical features, essentially the daily updates that were recorded by the nurse when they do the rounds in the ward, and then the treatment that the patient received during hospitalization. So let's start by entering the clinical features. So if we select clinical features daily updates, we will get an information screen, and then we hit next, and here we enter if the patient experienced bleeding, and in this case we have yes, the patient experienced bleeding, and so we select yes, and we now go next, and the patient experienced bleeding from the nostrils. So we select the bleeding site and go next, and the days the bleeding was experienced. If we had bleeding from different sites, we will have different pages to enter the dates for each site separately. Here we have nostrils bleeding, and it was observed only on the first day. And this is now, this list is showing the 10 days of the treatment cycle from D1 to D10. And as I mentioned, this the bleeding in this patient was observed on the first day after admission, so we select the corresponding option in the list, the D1. It's important to notice that in this list that shows treatment on the dates, the treatment days, the D is lowercase to differentiate from the days that are used to indicate data before admission. So in all these lists, we will have D1 through D10 with a lowercase d, which signifies that this is information corresponding to the treatment after the admission. So we have selected D1 here, and we go next. All right, so now what we have to do is to enter the maximum temperature register for this patient on each date. So here we'll have the daily updates for the temperature. So D1, 38.3, day 2, 38.5, day 3, 37.5, D4, 38, D5, 39.2, D6, 37.4, day 7, 39 point, excuse me, 7.5, day 8 is 38, day 9, 37.2, and day 10, 36. Okay, so we are done with maximum temperature. Now we'll have the maximum systolic blood pressure. We have for day 1, 140, day 2, 150, day 3, 110, day 4, 140, day 5, 130, day 6, 140, day 7, 120, day 8, 130, day 9, day 9 is here, 100, and day 10, 120. Right. So now for the maximum diastolic blood pressure, we have on day 1, 100, on day 2, 90, day 3, 90, day 4, 100, day 5, 90, day 6, 90, day 7, 90, day 8, 100, no, sorry, also 90, day 9, 70, and day 10, 90. Good. Now we have the maximum pulse rate per day, and pulse rate on the first day was 94. Pulse rate on the second day was 90. On the third day was 100. The fourth day was 90. On the fourth day was 90. On the sixth day, 86. On the seventh day, pulse rate on the seventh day, 84. On the eighth day, it's 100. On the ninth was 92. And on the 10th day, it was 100. Right, and now we have the maximum respiratory rate. So starting with the day 1, respiratory rate 26. 26 for day 2. Day 3, 36. Rate 24 for day 4. Day 5, 24. Day 6, rate. Day 6, 24. For day 7, 24. Respiratory rate. Day 8, 24. And day 9, respiratory rate 26. And for the final day of the cycle, respiratory rate is 24. Okay, and that completes the vitals. Now we might have had some clinical features during the hospitalization. So now we can enter those features. And here we have weakness for this patient. Weakness, and again, we can select as many as we want from this list. And in this case, it's just weakness. So we will go ahead, and this patient experienced weakness in the day 2 and 3 of the hospitalization. So we're done with that, and we don't have any other clinical feature to enter, so we continue. And any complications? Here we have the opportunity to enter complications for this patient. This patient, in fact, had anemia, so we'll select that here. And now we will see the option that is corresponding to the entry for anemia getting selected. And with that, we should be able to finish with the clinical features for the daily updates of this patient. So I'm gonna select next, and now we can enter the days the patient experienced anemia, and these are the 1, 2, 3, and 4. So we'll finish, and this will complete the daily updates form at the hospitalization.